Today we are discussing how patient factors change receptor exposure and contrast. This will include a discussion on patient size, atomic number, additive pathology, and destructive pathology. Now we will discuss patient factors and receptor exposure. As the patient size increases, attenuation increases. Therefore, it produces a decrease in receptor exposure. As the atomic number of an object increases, attenuation will increase, yielding an overall decrease in radiographic receptor exposure. Now let's talk about those same factors and the impact on contrast. As the patient size increases, more scattered radiation is produced. Therefore, a longer scale or lower contrast is produced. This may also be referred to as a decrease in contrast. As the atomic number increases of an object, more absorption will occur and less scatter. Therefore, a shorter scale or high contrast is produced. This may also be referred to as an increase in contrast. Now let's talk about pathological factors. We will begin with discussing that additive pathological conditions are those that cause the affected body tissue to increase in thickness, effective atomic number, and/or density. When this occurs, the X-ray beam has an increase in attenuation. Therefore, the overall receptor exposure decreases. This has an indirect effect on receptor exposure. With additive pathological conditions, most likely more scatter will be produced, resulting in an image with a longer scale of contrast or low contrast. Another way of saying this is more shades of gray will be produced. Now let's move on and talk about destructive pathological conditions. These conditions are those that cause the affected body to decrease in thickness, effective atomic number, and/or density. When this occurs, the X-ray beam has a decrease in attenuation. Therefore, the overall receptor exposure increases. This has an indirect effect on receptor exposure. With destructive pathological conditions, most likely less scatter will be produced, resulting in an image with a shorter scale of contrast or high contrast. Or another way of saying this is fewer shades of gray will be produced. So now let's talk about some of the basic types of pathology that you will see in the radiology practices. In general, additive pathological conditions could be something like abscesses, edema, or tumors. Destructive pathological conditions could be anorexia nervosa, atrophy, or emaciation. Now let's go ahead and focus on some conditions of the chest. Additive pathological conditions of the chest would be atelectasis, bronchiectasis, cardiomegaly, congestive heart failure, empyema, pleural effusion, pneumonia, pneumonectomy, pulmonary edema, and advanced cases of tuberculosis. A few destructive pathological conditions of the chest include emphysema or pneumothorax. Now let's talk about some pathology problems of the abdomen. Additive pathological conditions would include aortic aneurysms, ascites, cirrhosis, and calcified stones. Destructive pathological conditions may include aerophagia or bowel obstructions. Pathological problems of the extremities and skull would include the following. Additive pathological conditions would be acromegaly, chronic osteomyelitis, hydrocephalus, osteoblastic, metastasis, osteochondroma, Paget's disease, and sclerosis. The destructive pathological conditions would include active osteomyelitis, aseptic necrosis, carcinoma, degenerative arthritis, fibrosarcoma, gout, and hyperparathyroidism, multiple myeloma, osteolytic metastasis, and osteoporosis. So today in this presentation we have discussed how patient factors change receptor exposure and contrast, and that included patient size, atomic number, additive and destructive pathology.